countries. In short, to meet the ambitious goals of the Sustainable Development Goals, Africa needs to do more, do it faster, and make sure everybody benefits. It won't be easy, but I believe it can be done. The successes and failures of the past 15 years have generated examples and lessons we can follow. Phenomenal advances in science and technology are expanding the range of solutions available to solve development challenges. And then there's the ingenuity of the African people. One topic that Nelson Mandela came back to over and over again was the power of youth. He knew what he was talking about because he started his career as a member of the African National Congress Youth League when he was still in his 20s. Later on, he understood that highlighting the oppression of young people was a powerful way to explain why things must change. There is a universal appeal to the conviction that youth deserve a chance. I would agree with Mandela about young people, and that is one reason I am optimistic about the future of this continent. Demographically, Africa is the world's youngest continent, and its youth can be the source of a special dynamism. In the next 35 years, 2 billion babies will be born in Africa. By 2050, 40% of the entire world's children will live on this continent. Economists talk about a demographic dividend. When you have more people of working age and fewer dependents for them to take care of, you can generate phenomenal economic growth. Rapid economic growth in East Asia in the 1970s and 1980s was partly driven by the large number of young people moving into their workforce. But for me, the most important thing about young people is the way their minds work. Young people are better than old people at driving innovation because they're not locked in by the limits of the past. When I started Microsoft at the age of 19, computer science was a young field. We didn't feel beholden to old notions about what computers could or should do. We dreamed about the next big thing, and we scoured the world around us for the ideas and tools that would help us create it. But it wasn't just Microsoft. Steve Jobs was 21 when he started Apple. Mark Zuckerberg was only 19 when he started Facebook. The African entrepreneurs driving startup booms in the Silicon Savannas from Johannesburg and Cape Town to Lagos and Nairobi are just as young in chronological age, but also in their outlook. The thousands of businesses they're creating are already changing daily life across the continent. In a few days, I'll be meeting with some of these young innovators. People like the 21-year-old who founded Kenya's first software coding school to provide other young people with computer programming skills. And like the 23-year-old social entrepreneur here in South Africa who manufactures school bags from recycled plastic shopping bags. Besides being highly visible to protect children as they're walking to school, these school bags sport a small solar panel that charges a lantern during the journey to and from school, providing illumination so students can study at home. The full returns will come if we can multiply this talent for innovation by the whole of Africa's growing youth population. That depends on whether Africa's young people, all of Africa's young people, are given the opportunity to thrive. Nelson Mandela said, "Poverty is not natural. It is man-made, and it can be overcome and eradicated by the actions of human beings." We are the human beings that must take action, and we have to decide now because this unique moment won't last. We must clear away the obstacles that are standing in young people's way so that they can seize all of their potential. If young people are sick and malnourished, their bodies and brains will never fully develop. If they are not educated well, their minds will lie dormant. If they do not have access to economic opportunities, they will not be able to achieve their goals. But if we invest in the right things, if we make sure the basic needs of Africa's young people are taken care of, then they will have the physical, cognitive, and emotional resources they need to change the future. Life on this continent will improve faster than it ever has, and the inequities that have kept people apart will be erased by broad-based progress that is the very meaning of the words, living together. When Melinda and I started our foundation 15 years ago, we asked ourselves, what are the areas of greatest impact? It was clear to us that investing in health was high on the list. When people aren't healthy, they can't turn their attention to other priorities. But when health improves, life improves by every measure. Over the last 15 years, our foundation has invested more than $9 billion in Africa. And we are committed to keep on investing to help Africa. In the next 5 years, we will invest another $5 billion. Some of this money has gone into discovering and developing new and better vaccines and drugs to help prevent infectious disease. We've also invested in global partnerships that work closely with countries across the continent to get these solutions to the people who need them most. We've been fortunate to work with amazing partners, and together we've seen incredible progress. For example, the entire continent of Africa has been polio-free for 2 years, which puts us This puts us within reach of wiping polio out from the face of the earth forever. The newest vaccines that protect children from two of the most devastating diseases, pneumonia and diarrhea, are reaching children across Africa at the same time they're available for children in wealthier countries. Countries that invest in strong community-based primary health care systems, including Malawi, Ethiopia, and Rwanda, are making great progress reducing child mortality. Malaria infections and deaths are down significantly thanks to better treatment and prevention tools. And efforts like the Ouagadougou Partnership in West Africa are helping millions of women get access to contraceptives, which make it easier for them to care for their families. HIV/AIDS is another area where there's been good progress, though it's a complicated story and there are still big challenges ahead. In a few days, I'll be speaking at the International AIDS Conference in Durban. When the global AIDS community last met there in 2000, only a few thousand Africans were receiving antiretroviral drugs. Today, more than 12 million Africans are on treatment, more than a quarter of them living here in South Africa. So this is a huge achievement, and millions of lives have been saved. But the rate of new infections remains high. In sub-Saharan Africa, more than 2,000 young people under the age of 24 are infected every single day. The number of young people dying from HIV has increased fourfold since 1990. We need to get people to get diagnosed. We need people to seek treatment. And people who are on treatment need to be fully adherent. Along with HIV, we have high rates of tuberculosis, including here in South Africa, where TB/HIV co-infection continues to wage a devastating toll. So we need more creative ways to make testing and treatment accessible and easier to use. We need to get much more out of existing